Hey, everybody. We want to welcome you to WestCare, Texas. Let me tell you, WestCare Texas Foundation, we are on a mission to uplift the human spirit in many, many ways that we can. Tonight, our conversation, however, will be around the issue of COVID. We know that the president just last week decided to sign a moratorium that said, oh, COVID is over, COVID is done. We can move beyond COVID, but we have a guest tonight that will help us understand the need, particularly among communities of color who need to adhere to the need of continual taking the shots and getting ourselves taken care of from a medical perspective. And we look so forward to hearing from him tonight. Go ahead and tell us, chime in. Let me say this. You who are social media advocates, you are social media evangelists, go ahead and share, send some hearts, send some likes. You might not like what we're saying. We're going to tell you to still wash your hands, right? Keep washing your hands. I don't care where you are, where you're going, continue to wash your hands. We have an incredible guest tonight who's going to echo, I promise you, what I am saying, probably in a more kinder, more genteel, more empathetic manner. But he's here to answer questions on the what, why, when, how, and why. And we want to welcome him to the platform as we welcome you. Go ahead and hit the share button, send some hearts, send some thumbs up, send some likes. I like to say send your questions, send your comments, and send your ahas, right? Because some stuff you like, wow, I didn't know that, right? I didn't know that. And we're here tonight to educate you. We are here to rebuke the bewilderment. We are here to increase your knowledge so that the legacy of your family members, your community, your peers, your supporters can have a greater understanding and impact of COVID and the various degrees of COVID as a public health initiative, as a public health decree, as a public health cry out in our community. So we say welcome, welcome, welcome. Hello to our guests. Tell us who you are, what's your name, where you're from, and why is COVID important to you. Let's just chop it up. I'm going to pass the baton and let you share all of the wealth and knowledge that you have to impact our community so that we can continue to thrive. Go ahead. It's your turn.
Absolutely. So, hey, everybody, is Benjamin Conde. I'm a third medical student at UT Health Long School of Medicine. I
Hey,
have a
Benjamin.
Hey, I have a background in neuroscience from the University of Texas at Dallas, and I grew up nearby in Austin,
Ooh,
Texas. Thank you guys for having
okay.
me today. It's a pleasure to chat with you all. Like Dr. Keeley mentioned, I'm here today to discuss COVID-19 vaccines. I want to give all of our listeners a practical crash course on the shot. I want to discuss what it's made of, how it works, why I think you should get it, and why it's important that we talk about it. I'm hoping that everybody who's listening, who's on the fence or apprehensive about going to get their COVID-19 vaccine,
Mhm.
will leave this with some information or tips that will help them to make an informed decision about whether or not the vaccine is right for them.
Can I ask you, Dr. Benjamin, why is there such apprehension among communities of color? Why are there disparities in our communities, and why is there trepidation among communities of color from your perspective?
I think that's a great question, and I think one that desperately needs an answer. I think that it's not a secret. There's a long history of mistreatment by the medical community towards communities of color.
Mm,
We're all familiar with, the Tuskegee syphilis experiment, all those types of things. And I think that it's often posed by the medical community, the people in medical schools and in medical education as a mistrust that our community has towards healthcare professionals. But I think it is better termed as a mistreatment. And I think that allows like us as healthcare professionals to take accountability for the things that have happened in the past so that we can, do the work of reaching out our hand to, provide the information and the help and to rectify that type of situation so that we can create equity. There's a big talk around healthcare disparities and health
mhm,
equity. And,
mhm,
that is why I went into medicine. That's why I'm here today, is to try and address those disparities to create equity for people of color in medicine. And I think that there's no area that needs more equity than COVID-19. I think that people, that I think the reason why this conversation matters so much is because the black community and the Hispanic community have experienced like a disproportionate burden of COVID-19 infections and deaths. The CDC has published information that's showing that Hispanic and Latino people are 1.5
mm.
times more likely to be infected by COVID-19 than their white
Yes.
counterparts.
Yeah.
1.8 times more likely to be hospitalized once they're infected, and 1.7 times more likely to die. Similarly, Black people, African American people are 2.1 times more likely to be hospitalized for COVID-19 if they're infected, and 1.6 times more likely to die. And I think that that's the reason why it's that much more important that people from our community go out and get vaccinated.
So, how do you influence communities of color to break beyond the stigma, to break beyond the shame, to break beyond the trepidation and become COVID inclined? How do you do that?
I think that it really is just a matter of showing up. I think that it's very easy as a healthcare professional or somebody in the medical field to kind of separate yourself from the community. It's, you can spend all your time hiding away in the hospital or in the classroom or in the clinic. But I think there's nothing more important than being in front of people, being out in the community, going out to help people, meeting people where they're at. The way
Mhm.
that I got involved in this project, I went to a community event at a church up in North San Antonio that was providing information to a predominantly Black.
All right, can I stop you there? You said North San Antonio.
Yes,
Was
ma'am.
that a church that was community colored church or
Yes, the congregation was mostly Black. Yes, ma'am.
all right. I
It
just
was
have to stop and pause because we are talking about helping communities of color access what is needed to help uh, refute these disparities among communities of color. I want to ask you, just because I can tell you are well informed, well engaged, why is it important that particularly communities of color, make sure that they continue in the acumen of receiving the COVID shot?
so, similar to what I was saying, or like I was saying before, we do receive a disproportionate burden of the like harm and injuries and death as a result of COVID-19. I think that, to bring it closer to home, we have some ticker information down below
Yeah.
stating that, 22 zip codes in Bexar County that contain a third of the population are, they contain 50% of COVID-19 related deaths. And the thing about those zip codes is that they have decreased access to vaccination, information regarding the vaccine, and a higher proportion of socioeconomically disadvantaged peoples, people
Mm.
from the Black and Brown community, things of that nature. And that's why we need to reach our folks over there, and make sure that everybody has the access that they need to those vaccines.
So you mentioned earlier the shock factor of the Tuskegee Institute. I like to call it a dilemma for those of us who have studied the history and the implications of medical procedures being done on communities of color. How would you diffuse that? How would you give out the rallying call, the clarion call, that it is important for us as people of color to make sure that we receive the COVID shot so that we can remain healthy and rebuke the disparities that are in our communities? How would speak to that?
Yeah, I think that really the most important things is showing up, making sure that people can see you where you're at, right? A lot of
Mhm.
people that come across Black doctors and healthcare professionals are like, I've never seen it before. People need to know that we're out here, we're here, we're working in this field, and we're here as a resource and an advocate for you guys. Um, I think the other thing is acknowledging the things that contribute to these things, so that contribute to healthcare disparities and healthcare inequities, so that we can have a more honest conversation about what the issues are. I think it's easy to just say like, oh yeah, like people from communities of color just have worse health outcomes because of this, and that. But I think that taking the time to talk about social determinants of health, the things that cause these issues, like built environment, the type of work that people are doing, those types of things, so
Yeah.
that we can try and remedy those issues is what's
Yeah.
really important.
So, what are you doing on a professional and, might I add, a personal level to make sure that Black and Brown communities are not forgetting to continue to wash their hands? Continue, right? Continue. We know the president just last to etch in stone that the COVID epidemic is over. But
Right.
we also know that, again, among communities of color, particularly Black and Brownly shots, in number shot number two. Uh, how do you address, do I still need to get a vaccine? People are wondering.
That's a good question. I think that one, reframing how we think about it. I know that COVID-19 is a new thing. It's new and emerging to everybody. So we're still trying to figure out how we should be thinking about this. Is this something that's going to come and go? How is it going to go? I think that it's pretty healthy to think about the COVID-19 vaccine the same way that you think about the flu vaccine. It's something that you should go and get a booster shot for on a yearly basis. I think that we're headed in that direction. There's new and emerging strains for COVID-19 that we're talking about every year. There was the Omicron strain, the Delta strain, all those types of things. And that brings me to another point. I think that getting out good, accurate information is important. Being available for honest, candid, relatable conversations is important. As frequently as I'm able to, I try and have those types of conversations. If I'm at the barbershop, I try and have a conversation with the folks over there. I remember when the vaccine was first coming out, I was living in Houston, Texas at the time. And I was there getting a haircut, and everybody was like, oh, I don't want to get the vaccine. I'm not going to line up for it. I don't want to be first, because I think people were kind of shocked how fast it came out. There's this big idea that the vaccine was rushed, that it wasn't safe, that it was this and it was that. And I felt the same way. I was pretty apprehensive. I was pretty surprised how quickly they were able to develop a solution to the issue. But I think that just speaks to the fact that, this is a multi-billion-dollar worldwide effort that's gone into creating a solution to a very severe problem. Um,
Right.
and this technology also isn't new. They've used mRNA vaccines for the flu, for Zika virus, for adenovirus, for a lot of other diseases that have existed in the past for decades. They've been using it.
Now,
Um,
you know what MRA is, but talk to our audience, break that acronym down.
Absolutely. So Pfizer, Moderna, they make what's known as mRNA vaccines, right?
Mhm.
mRNA is just short for messenger RNA. When I say that, folks get a little bit scared because it sounds real close to DNA. They think that if you take the vaccine, it's going to change up your genetic code, all that type of stuff. That's
Oh, wow.
That's not the case. All it means is that it's the vaccine has a set of instructions that is used to develop a certain protein that's useful for teaching your body how to defend itself against COVID-19. It creates a molecule called a spike protein. A spike protein is just a piece of it's a molecule that's present on the surface of the COVID-19 vaccine.
Mm.
It doesn't have
Yeah.
any viral properties. It can't infect you. It won't give you COVID, but it does show your body how to recognize COVID-19 when it shows up.
Wow. Is there a difference in what COVID does to uh, African American community versus our Caucasian community? And then we have a lot of fear and trepidation because there's a new strain out called the Kraken. Can you speak to that?
Yeah, so there's no difference in how, COVID-19 affects Black people or Hispanic people or any other people for that matter. The things that create the difference are, these social determinants of health that impact how we're able to defend ourselves against the vaccine. That's the type of work that people are doing. As of 2018, 36% of the nursing workforce was Black people. 20% of employed Black and Hispanic men were in the service industry working essential jobs. They weren't able to adhere to those CDC guidelines saying to work remotely or stay at home or do all those things,
Mm-hmm.
like their non-white or non-Hispanic white counterparts were. That increases the incidence with which they'll get infected with the disease. The locations that people live in. A lot of people in racial and ethnic minorities live in homes with many family members of various ages. They may live in crowded conditions or heavily populated areas like New York City or wherever else. That makes it harder to distance from other people. And I think those are the things that make the difference.
Yeah.
The Kraken strain, a new strain, there's a lot of new information coming out, and I think that we're still learning about it.
Mm-hmm.
Um, and I think that the best advice is to just like stay armed with information and stay informed, just to keep yourself safe. Continue to wash your hands, like you mentioned earlier. Keep wearing that mask when you're able to, just to protect yourself.
Yeah, and then there are a lot of frontline workers, grocery workers, delivery drivers, again, because these are jobs that, those who are in communities of color can adhere to and participate in. What would you say to that population of people who are the frontline workers, who are the workers who have to be encumbered with thousands of people because they have to work a job? How would you suggest that they facilitate a health ecunym going forward?
I think that for people who are in those positions that you're talking about, this is really who that conversation is for. As we know, we can't stay locked up in our houses all day long, waiting for the storm to pass by. We have to get out. We have to live our lives. We have to go outside. And if you're going to do that, then I think you just have to do it safely. You have to wash your hands. You got to wear your mask. Keep the hand sanitizer on you. I still keep hand sanitizer in my car, in my backpack, that type of stuff. And staying vaccinated. I think that another big reason why people need to get vaccinated is because it reduces your chances of getting infected. If you do happen to get infected, it makes the illness less severe. And it helps protect everybody else in the community, the more people that are vaccinated. So just doing that for yourself, I think allows you to be able to go out of your house and live your life without the stress of worrying about getting yourself sick or your family members.
Wow. So here's a question that I have for you. How do we debunk and dispel the myths that are surrounded by COVID? Our community will shake a leg, will say, I'm not doing it. How do we dispel and debunk the myths rather that exist around the COVID epidemic?
I think that it comes down to the myth busting thing. It really comes down to having good sources from trusted messengers, right? All the information that I'm giving you guys is coming from the CDC, the Mayo Clinic, Health Confianza, and it's not anything that's a secret that you can't go and find online. There's a lot of misinformation out there, but just sticking to those sources that you can trust. The city of San Antonio publishes new COVID-19 information all the time. I think that those big names are the big trusted sources, and having conversations with people that you already entrust your health to your physician, any healthcare workers that you know, people that are educated on these things and can have like a good conversation and tell you what's what.
Yeah. So, based on your knowledge and all that you do, what's happening in Bear County? What's happening with COVID in Bear County? You can either focus on communities of color or at large. We need to know what's happening. What's happening with COVID in communities of color?
Right. So, as I mentioned earlier, and as the ticker says, we have some communities in Bexar County who are in need of help. They are experiencing more COVID-19 complications and deaths than any other part of the county. And it's just those 22 zip codes that Health Confianza likes to focus their energy on because they just need the most help. I think that there's just a lack of information out there, and a lack of access. Maybe less people that are insured, those types of things. Um, I will say that things are looking better. The city of San Antonio, they published data saying that there was 670 new cases this week. 670 is a lot, but it's a lot less than it was, maybe a year ago or 2 years before.
Yeah.
So that's good. And I think that there's also a lot of good vaccination initiatives coming up. Metro Health will be giving out free vaccines every month. On Wednesday the 19th, Health Confianza is going to be at, sorry, just one moment. Oh, Metro Health's Fiesta de Salud
Yeah.
event, from 3 to 7 p.m. at Crockett Park,
Crockett
1300
Park.
North Main Avenue. Yes, if you show up there, you can get a vaccine and they'll give you a cool medal. I wish I had one here to show y'all.
Man, we want those medals. Is it a Fiesta medal? We want them. We want them.
Yeah, yeah, real cool medal. That you can show up and get. You can go to your HEB or CVS to get vaccinated. Um, I think that there's a lot of effort going into trying to reach people in that community, to make sure that they're getting the help they need.
How do we break the stigma among the African American community, and why should I take the COVID vaccine?
I think that there's a big misconception that if you get infected with COVID-19 one time, it maybe won't be that bad. People like to say, oh, it's like the flu. You'll get something that kind of feels like the flu. It'll go away and then you'll be immune from COVID-19. But that's just not true. COVID-19, when you're unvaccinated, the sickness tends to be more severe. You have worse outcomes and it has a higher chance of progressing to long COVID. We haven't talked about that yet, but long COVID is like a COVID-19 infection that lasts longer than 3 months. You can get symptoms that range from fatigue to brain fog, shortness of breath, heart palpitation, muscle, joint, or chest pain. Now, the reason why I think that it's important that we try and avoid these things is because these symptoms can persist for weeks to years. You can lose your job. It can affect your ability to interact with others socially, your family, upend your life. And we don't really have a lot of definitive treatments and cures. So I think that, doing what you can to stay safe and taking advantage of the resources available to you are really important. I think that the reason why people from the Black community should get it is because, simply put, it works. There's studies showing that there was a study that was conducted where 40% of the population was vaccinated. That 40% included high-risk patients, healthcare workers, people that were on the front lines, and it led to reduced adverse outcomes. The rate of non-ICU hospitalizations, ICU hospitalizations, and deaths decreased by 63.5%, 65.6%, and 69.3% respectively across the whole population.
Wow. So you have given us quite a bit of information on COVID in the African American community. I want to ask you, have you taken your COVID shot?
Absolutely. Yeah. So when
Why did you
the
do
vaccine,
that?
say that one more time.
Why did you take the COVID shot?
Well, when the vaccine became available, it was just this weird time. I was living in Houston. I was studying healthcare disparities and stuff like that at Baylor College of Medicine over there. And like I said earlier, I'm from Austin, Texas. My mom, my dad, my little brother, they're all out there. And I try to go home as frequently as I can. And I was just so scared all the time trying to go home and visit my family. I'm like, what if I show up? I get my mama sick. I get my dad sick. They're both getting older, all that type of stuff, and it just was very nerve wracking. It made me nervous. So when the opportunity came to do something, it wasn't even for me, because they always say like, oh yeah, if you're younger, the risk is not that bad. If you don't have like some sort of comorbidity like diabetes, hypertension, it won't be that bad. But it wasn't just about me. I have a family. So I did that really for them. And my friends that I see, just to make sure that I'm not bringing unwarranted danger or unwanted danger around them unnecessarily. I actually had access to it pretty early on, and I was apprehensive about it. But when I weighed the risk versus the benefit, the choice was easy.
Yeah. I want to ask you this. COVID-19 vaccine is one of the strongest tools we can use to fight the pandemic together. Talk to us a little bit about why getting the vaccine adds an important layer of protection for you, your loved ones, your family, your community, your colleagues, your peers, your church family. Talk to us
Mhm.
about that.
Yeah, so I think that the big impact of getting vaccinated is that the more people that are vaccinated, the more you're able to protect the most vulnerable portions of the population. People who have systemic illnesses like diabetes, high blood pressure, any kidney or liver disease are very susceptible to having some sort of severe illness, and they'll be in a lot of danger if they get infected with COVID 19.
Yeah.
If you have a vaccine, if you've been vaccinated, your chances of transmitting COVID to somebody else are less. You're safer to be around for those people. For elderly folks, everybody's got a grandma, everybody's got a grandpa. If you want to come around them, I think it's important to be vaccinated. They just can't take these things and bounce back from them as well as the rest of us can. There are lots of folks who have immune systems that don't work as well. The term immunocompromised is a term that I think everybody's become very familiar with. It's a real thing. Some people's immune systems, for whatever reason, there's a range of things that can cause it, that will cause your immune system to just not work, to be compromised. Those people have no way of defending themselves against COVID 19, you know. And I think it's good for everybody in the community if more of us are vaccinated.
So we do have some questions coming in. One of them is, can I get a new vaccine when each new strain comes out? Can a pregnant woman or people who want to get pregnant get the vaccine? Should they get the vaccine? With these new strains, are there new opportunities for us to get new shots, different shots? Talk to us about that.
Absolutely. So I'll address both those questions. First and foremost, if you are pregnant, if you want to get pregnant, or you're about to be pregnant, you can get vaccinated. You can absolutely get the vaccine. It's perfectly safe. If anything, I highly encourage it even more if you're pregnant to get vaccinated. Yes. The second thing, for with regards to new strains, Moderna, for instance, has released what's called a bivalent booster shot. Bivalent just means that it has efficacy against two different strains of COVID 19: the original strain that came out in 2020 and the Omicron strain that became more prevalent last year. I don't know that if there's a booster shot that is effective specifically against the Kraken strain just yet. But that is something that these vaccine companies work on a pretty regular basis. So yes, they try to keep these booster shots up to date and current, and that to provide coverage against whichever strain is most prevalent in the population at the time.
Are communities of color being affected by COVID over other communities from your perspective?
I think so. For a lot of the reasons that we've previously discussed, they absolutely are. They're facing a higher burden. I think that unfortunately, people who come from communities with more resources are better armed to protect themselves. And a lot of our Black and Brown communities don't have as many resources as others. We already talked about how where you work and the location that you live in can impact your ability to protect yourself, but also access to healthcare. You know, um, 18% of Hispanic people are uninsured. 10% of Black people are uninsured. This is as of 2020, whereas only 5% of non-Hispanic white folks are uninsured. That makes it harder for them to go and see a doctor, harder for them to go and get access to information they need when they do get sick.
Wow, it makes it harder. And communities who are already plagued with disparities, transportation issues, financial issues, have a harder time of moving forward in making sure that uh, we take care of ourselves, that when we go to our public officials for these shots, that we can take care of ourselves. I want to say thank you for sharing. And I want you to just kind of, I'm going to throw a quote out here to you because I love how you give voice. I love your professionalism. I can tell you have lent your life to this work, but the trauma and the outcome of trauma, particularly looking at 50% of COVID deaths in San Antonio, right? That is trauma. And how do we help people understand that it's not their fault, but their healing is their responsibility? Can you address that? That the healing and getting connected to healing is their responsibility. How can you address that as we close?
Yeah, I think that it's just good to make the point that getting the vaccine, even if you feel like you don't need it, is good for everybody else around you. I think it's the best way to take care of, the people next to you, your neighbors, your friends, your loved ones, all those types of things. It's the only way we can build herd immunity. I do want to leave y'all with some take home points. If you haven't heard anything I've said, the big things that I just want to make sure everybody knows is that you will not get COVID-19 from taking a vaccine. The
Yeah,
vaccine won't change
yeah.
or damage your body's genetic information. Um, Even if you have been vaccinated or boosted, you should wear a mask and you should wash your hands frequently if you're in crowds to just keep everybody else safe. There's no evidence to suggest that COVID-19 has any impact on fertility. I know that's a big one that people like to talk about. If you're pregnant or trying to become pregnant, you can definitely get the vaccine. Um, and getting infected with COVID one time will not make you immune. The only way to gain some immunity is to get a vaccine.
Wow. Thank you so much. And I want to leave with the slogan that is out all over the world that says, quote, together we can reduce COVID-19. Let's stop it, and let's stop it now. Let's take the steps and be bold and be bodacious and have the audacity to say, no matter what has happened in our past among communities of color, we live in a here and now, and we have a responsibility to make sure that we are not infecting others because of our ignorance, our fear, stigma, and shame. We want to say bravo to you for being here tonight. You have certainly opened up the eyes of our understanding, and we thank you for that. We thank you for caring enough about uplifting the human spirit of people from all walks of life and to say yes to the COVID shot, yes to making sure that you are protecting you and yours and everything that matters to you. Thank you so much for being here with us tonight. And if there is anything that WestCare Texas can do to help communicate this message beyond what we are doing tonight, we definitely will be available to do so. But thank you so much for being here. Your light is right on your camera. Your background is right. Your smile is right. Your beard is flowing and growing. So thank you so much for being here. And thank you, sir, from the bottom of our hearts for all that you do to make sure that communities of color and people from all walks of life take the COVID shot so that together we can heal and uplift our communities for greatness. Blessings on your evening, sir.
Absolutely. Thank you very much. I really appreciate you guys for having me. It's been a pleasure to talk to you all.
Blessings to you. Bye
All right.
bye.